Is your shoulder pain coming from a rotator cuff tear or shoulder impingement? This is a question that I get all the time, and really healthcare professionals even confuse this. And you'll get pain when you're reaching up, if you lie down on that side, or definitely if you're picking up anything with some decent weight, it can set off that shoulder pain. And if you don't have a clear, precise diagnosis, it's hard to know which is which. And then people get confused on what treatment there is, because healthcare professionals will tell you that treatment for shoulder impingement and rotator cuff are very different. But I have some different outlooks on this. I'm going to explain it to you and give you the details on the differences between shoulder impingement and rotator cuff tears, and then also how to tell apart the symptom, the typical treatments that are involved. And then I'm going to talk about the root problem related to both shoulder conditions. Let's get started with shoulder impingement. Let me just tell you what it is. So if we look at the skeleton here, here's the ball and here's the socket of the shoulder joint. The socket is part of the shoulder blade. This is important to note. And whenever you move, whenever you reach your arm up or to the side, that ball moves quite a bit on that socket. The thing to note is that the socket's kind of tiny. Compared to like the hip joint covers up quite a bit of the ball down in the hip and the ball and socket joint of the hip. But when it comes to the shoulder, it's like tiny compared to the ball. And so as a result of that, you have a ton of muscles that are providing stability. You have a lot of cartilage in the area as well. And then the big important factor that gets overlooked all the time, more on this towards the end of the video though, is that the shoulder blade has a lot of motion that we're not taking advantage of. So in shoulder impingement, this space right here where I'm shoving my pinky, that space is usually closed down. This part of the bone that overhangs above the ball is called the acromion. It's a part of the shoulder blade. If I show you on the back, you can see this is called the spine of the scapula. It kind of flattens out and broadens out here, and that's called the acromion. It's an important muscle attachment site. There's a big ligament that connects from this part to this thing that pokes out right here. And so it kind of creates like a bit of a socket depth to it, but it's soft tissue and a little bit of bone. That area anyway gets, the ball shoves up into this area because of some muscle imbalance problems. I'll tell you more about that. And that's what creates impingement. Nothing's torn just yet, but things are getting smashed in there and your body's telling you, your shoulder starts to hurt. And so when you go to reach up overhead and do things, you further pinch the tissue there. See, my pinky's getting smashed right there. And that's what causes that pain. Now, the reason for the ball drifting up is because of rotator cuff muscles that aren't doing their job. They start to be overworked and then they start to shut down. And as a result of that, other muscles will compensate. And because of the pull of certain muscles, it'll pull the ball up into the socket. Now, the difference between shoulder impingement and a rotator cuff tear is that with a rotator cuff tear, there's muscles in the shoulder. Let me show you on this skeleton here. All these red things right here are the rotator cuff muscles, and then the white things that go outwards right here are the tendons that connect the muscle to the bone, and they attach to the outer part of the ball right here. And they're called the rotator cuff muscles because secondarily they produce rotation in the shoulder. They can twist the arm bone in different positions, but really their primary job is to suck the ball into the socket, to compress and depress the ball into the socket, so it should pull it down. So when they're not doing their job, that's why the ball goes up on the socket. But when they are doing their job, the ball goes down and it's centered on the socket where the main motion should happen. If a problem goes on for too long, then these tendons become overused and you get a tear. That's what sets up a rotator cuff tear. And then at that point, you have a disconnect of the muscle to the bone and you have a legitimate loss of motion. And people feel this. So this is how you can tell apart the difference between a rotator cuff tear and a shoulder impingement situation. A clear difference is that you just can't raise your arm up. People will often say, it hurts, and then when I reach up right here, it doesn't want to go anymore, and they have to bring it back down. That is like a clear indication that you probably have a rotator cuff tear. There's a few other things that it could be, like arthritis and like a biceps tendon problem. There's other things that can contribute to this, but that's one of the most clear signs that I consistently see in people that have a rotator cuff tear, is that they can't reach their arm up. When you think about a rotator cuff tear and shoulder impingement, they fall on a spectrum. So if we just draw a spectrum right here, shoulder impingement would be on this end, and then on the, I'm just gonna write IMP, On this end would be a rotator cuff tear. And in the middle, you'll get things like tendinitis, and you'll get bursitis as well. I might have misspelled it. And other issues that will come up, like with the bicep and with nerve problems as well. There's other things that happen in between, but it's absolutely common to develop shoulder impingement, what a medical professional, what a healthcare professional would describe as shoulder impingement at the start of a shoulder problem, and then along the way have bursitis, tendinitis, and if it keeps going, then you develop a rotator cuff tear. And if you go on beyond that, it develops into shoulder osteoarthritis, and then beyond that, you're getting a replacement, and you could still have problems because the underlying commonality between all of this is that there is a muscle imbalance that affects the shoulder the whole time. And if that muscle imbalance isn't corrected, then things just progress this way. And over time, as you get older, you start to get worse and worse problems, but it's because of this muscle imbalance. It's not an age-related problem. A lot of people think that rotator cuff tears are age-related because they tend to happen when people are in their mid-40s. The most common group that it affects is females in their mid-40s, definitely into their 50s. The rates of rotator cuff tears skyrocket. But we've seen rotator cuff tears in people that are just very active with overhead activities that are in their 30s or 20s. And I think that's just because they're feeding into that imbalance a lot sooner, and so they're running into the rotator cuff tear sooner. They develop impingement, they're working through it, they're exercising through it, and they force their way into a rotator cuff tear. But if you can fix the imbalance, which I'm going to tell you how to do in a second, then you can disrupt this cycle and have good shoulder health. Stay on this end over here where you're feeling fantastic and you can do everything you want to do. You can lift weights up overhead. You can do your general activities reaching up overhead. You can sleep on your shoulder. You're not getting numbness and tingling problems. Neck pain is commonly associated with both impingement and rotator cuff problems because of the muscle imbalance. This can be totally fixed. When you reach up overhead specifically, you should be rotating your shoulder blade up. Let me show you with this skeleton. Here's what the shoulder blade should look like, and because the socket faces sideways, you can see the socket right there. When you start to reach up overhead, this skeleton, the shoulder blade bone is screwed onto the ribs just to hold the skeleton together, but in our bodies, in your actual body, the shoulder blade can move. What should happen as you reach up overhead is your shoulder blade should shrug up and then rotate up so that socket is now facing, instead of sideways, it starts to face upwards. When you do that, you stack the ball onto the socket and you're not taking that ball and socket joint to the end range and pinching the tissues in there, causing impingement. You're not forcing your rotator cuff muscles to work in an inappropriate way because they just work in the same way. They're still compressing and depressing the ball into the socket, but now in this position, you're using gravity too because you're stacking. That's how you should be reaching up overhead. But a lot of people don't do that. They, in fact, get told throughout their exercise careers, don't shrug your shoulders, pull your shoulders down and back. But when you reach up overhead, you should actually be shrugging your shoulder up instead of keeping it down and back. Let it go in the direction it's supposed to. So that's the basics with overhead, but let me just give you the general principle. I call it the rule of the hand. The way that you should move your shoulder blade is wherever your hand goes. So in that example, your hand's going up overhead, then your shoulder blade should follow up overhead. Shoulder blade follows the hand. If you're reaching forward, then your shoulder blade should follow forward. Your shoulder blade should move forward on your body as your hand goes forward in your body. All of this is proportional. So if you reach forward a little bit, shoulder blade goes forward a little bit. If you reach forward a lot, maximally, then your shoulder blade should go forward maximally. So think of this with like exercises, like if you're doing a bench press or a push-up, your shoulder blade should round forward. And at first, if you've been trained, if you've kind of grown up thinking you should bench press with your shoulder blades back, it's gonna feel weird. But when you do this and you push your arms forward with your shoulder blades forward, all of a sudden you feel your chest muscles engage, which is what should be happening when you do a push-up or chest press. So it just makes sense. And then when you reach toward your body this way or behind your body, then you should be pinching the shoulder blade back and using the muscles that bring the shoulder blade this way, because that produces the best stability and the best position for the socket in the ball and socket joint, so that you're not overusing your rotator cuff tendons. That muscle imbalance goes undetected. The healthcare community at large doesn't even know about this. And so they're not telling people to fix their shoulder blade motion and follow the rule of the hand. They're just telling people to avoid the motions that hurt. So don't reach up overhead. Don't pick up that heavy thing. Stop doing CrossFit. Stop doing, weights, whatever it is that you're doing. And really all those things are probably good for you as long as you're using good shoulder mechanics, which means you have to fix the muscle imbalance. And whether you're on this end of the spectrum and you just have impingement right now, or you've moved along to here or beyond, you're still going to benefit from implementing the rule of the hand to fix the muscle imbalance. Now, that's just one piece of the whole picture here. I've got a lot of things that I put in my treatment approach, but the rule of the hand is kind of a pivotal thing to learn, to master along the way. The rule of the hand is just one part of the treatment approach. It's a big milestone. Once you figure that out, you're set to make a lot of improvements. But in our whole treatment approach to helping people with rotator cuff tears and shoulder impingement problems, there's a bunch of little things that need to be done. I've got a bunch of exercises here on YouTube for both conditions, but there's one video in particular that I think you should check out next if you have a rotator cuff tear. It's called the top 5 rotator cuff tear exercises to help heal naturally. Go check it out.